Hi, I'm Brittany Frischman. I work here at SEK Multi-County Health Department. I'm going to show you how to keep your baby safe. Safe sleep is a topic that gets overlooked a lot, but also has a lot of controversy. So I'm just here to help you lay out all the information so you can keep your baby as safe as possible. So we're going to look here, and this is not a safe sleep environment. So in order to make it safe, we want to remember three things: A, B, C. Alone, on your back, in a clutter-free crib. And together, this is just going to help remember everything. And because it can be a lot being a mommy and being tired and taking care of a baby. So first, we're going to start out, make sure baby's in a approved sleep environment, make sure it's not damaged, doesn't have any holes, broken wood, anything like that. It needs to be in good repair. So first thing, looking at baby, that I see is baby is wearing a wearable blanket, which is good. When putting baby to sleep, you always want to dress them in about one layer of clothing that's warmer than yours. So in winter, if you're wearing a long sleeve shirt, maybe put like a onesie, like long sleeve jammies on them. You don't want to wrap baby in a blanket. Even if you do the really tight burrito swaddles, it's very easy for these blankets to come undone and baby could get them up to their face and suffocate. So if baby is cold, don't use a swaddle. Use a wearable blanket. And they have different ones. You can have fleece in the winter, cotton in the summer, and up until they're 3 months old, you can actually put their arms inside, and it just helps baby sleep a little bit better. So when you lay them down, they don't have that startle reflex. Hats, and unfortunately, those super cute big bows that you put on baby to look cute need to come off. Especially those bows. They can get so heavy, baby, when they're sleeping, stirring, they can pull them down over their face and suffocate. So now you're probably wondering, what am I going to say about the pacifier? Well, good news, your baby can still suck on a pacifier. If you're breastfeeding, you may want to wait until breastfeeding is established to kind of help with nipple confusion, but pacifiers are actually proven to help reduce SIDS. And if you're breastfeeding, you'll actually have double the protection because babies who breastfeed for at least 2 to 3 months have a 50% decrease in dying from SIDS. And so that's just another way you can protect your baby. So pacifier is a yes. Wearable blanket is a yes. Swaddle, hats, bows, no. So next thing that we're going to see is pillow. I know as a mom, you want to try to get the hacks, and sometimes babies just don't sleep as well when they're not in your arms, because who wouldn't want to sleep in their mommy's arms and feel safe and warm? So a lot of moms will use pillows to try to make it feel like it is being held and sleep better. And some moms think that, like, I don't want my baby to like get a sore neck, so let's put it on a pillow. So this is actually really dangerous. And sadly, what we see a lot is your squirmy little baby can turn and twist and get its face shoved up like this, can get its face down here, or its little neck muscles may not be strong enough at all and may just turn and be flat face in the pillow. And this is a huge suffocation risk. I have seen way too many pictures where poor babies have died from suffocation from pillows. So please take the pillows out and have your baby sleep on a flat surface. They do not need to be inclined. They are perfectly fine to stay flat. Now, the most controversial is baby laying on their back, because there's been a lot of chitter chatter. Is it healthiest for baby to be on their side, on their stomach, on their back? I can't keep up. Well, I'm here to tell you, safest for baby to sleep on their back, and you want to keep them on their back until they can roll over independently from their back to their stomach and their stomach to their back. They're strong. Once they do that, you're good, mama. But until then, let's keep them on their back. And I know when you talk to your mom or your grandma, they're going to say, no, because what happens when the baby spits up? Well, babies are amazing. They have so many little reflexes that keep them safe. So when baby's on their back and they spit up, they'll either swallow it, or they actually have a reflex where their head goes to the side and they can just spit up. But when babies are laying down on their stomach, they don't have that option. In fact, gravity is helping them to not get it up. So in order for baby to choke on their spit up or throw up, it would actually have to go against gravity, and it would have to go up the esophagus to get down into the trachea. And that's just not going to happen. So tell everybody, put my baby on the back, especially when they go to daycares or grandparents' house, because if you're used to your baby sleeping on its back and you put them on their stomach to sleep, they're at a higher increase of dying from SIDS. So just letting them know and educating them on why it's so important. Lastly, we have clutter. Toys, shoes, everything like that does not need to be in the crib. And I am guilty of this. With my first two, tired mom, have diapers, wipes all over the place, put them in the bottom. So then I can just quickly change baby. But like we said, these babies are squirmy. They're going to be moving all over, and these are suffocation risks. So if that's what you want to do, you can get little baggies to put on the side and on the bottom. Put them in there. Get a little shelf to put on it, but don't put anything in here. Some extra ways that you can help your baby besides breastfeeding to decrease the risk of SIDS is to not smoke in your home. Smoking, it has an effect. We're not too sure what really causes SIDS, but we do see that the studies show that there's an increased risk of SIDS in mothers or homes that smoke. So just having that secondhand, third-hand smoke can increase your baby. So if you do smoke, here are some ways you can help your baby stay safe. Go outside to smoke. And I always suggest getting like a smoking hoodie or jacket or something. Then coming inside, taking the hoodie off so your shirt's clean, washing your hands, and that helps your baby not get that second and third hand smoke. So smoke outside, wear a smoking hoodie, wash your hands. And so again, baby is alone on the back in a clutter-free crib, no hats, no extra things, just this. And this is going to help you keep your baby safe.